guys, my name is Taylor Floyd. I am a junior at Auburn University in nursing school, and I am from Smith Station, Alabama. Today I'm going to talk to y'all a little bit about cancer and Vietnam veterans, specifically cancer in relation to Agent Orange in Vietnam veterans. I'm also going to talk to you a little bit about prevention and treatment options available to these veterans as well. I'm going to discuss 5 key points that I learned when researching for my paper. The first thing that you need to know is a little background information on Agent Orange. Now, I know you're probably sitting there wondering, what is Agent Orange exactly? Agent Orange was an herbicide used in the war to kill the thick foliage that protected the enemy. It contained a chemical called TCDD, and this chemical is a carcinogen that many researchers believe is a carcinogen responsible. Research has also found that Vietnam veterans are at a greater risk for poorer health than those who did not serve in the war. In fact, Vietnam veterans have a 33% increased chance of developing cancer when compared to non-veterans. The second thing I learned was how this herbicide is related to cancer. Like I already said, evidence supports that this TCDD chemical is the carcinogen responsible. Evidence also supports a correlation between cancer development and those exposed to it, especially for those involved in the preparation and administration. And that just goes to show that direct exposure to Agent Orange does correlate with cancer. The third thing I learned were the specific diseases that are associated with the herbicide. The U.S. Department of Veterans Affairs, or VA, recognizes cancers such as Hodgkin's disease, non-Hodgkin's lymphoma, prostate cancer, respiratory cancers, and soft tissue sarcomas, among various other acute and chronic diseases, as being related to Agent Orange. You can go onto their website and check that out. There is a list of many different diseases, as well as these cancers, that the VA contributes to Agent Orange exposure. The fourth thing that I learned were all of the prevention programs the VA has in effect to help veterans avoid cancer. The VA's biggest recommendation is through health promotion and living a healthy lifestyle. They really recommend and encourage veterans to stay active, to improve their diet, to get regular screening tests, and to exercise regularly, as well as staying away from hazards and to quit smoking. They also have a program in effect called the Agent Orange Registry Health Exam. And this health exam is offered to anyone who is exposed to Agent Orange. And it is a physical that is done on these people, and it includes lab tests, urinalysis, electrolyte screenings. It is just a very in-depth physical that these veterans can have done if they were exposed to Agent Orange. Now, another big promotion factor that the VA really encourages is education and information. And they offer this by having a toll-free number that these people can call. They have the Agent Orange newsletter. They have information booklets, pamphlets, fact sheets, and brochures. They just really want to get these signs and symptoms and risks that are associated with Agent Orange out there so these veterans have access to the education and information that they need. Now, the fifth and final point that I want to talk about are the treatments available for these veterans. Many of these treatments are common treatments that we are all very familiar with, such as chemo, radiation, and surgery. The veterans also have options available such as hormone therapies, approved drugs, and alternative therapies. A lot of this is very dependent on the type of cancer. So like all those cancers that I listed earlier, it depends on which type of cancer it is, as well as where it is located and the size. So the treatment options are very common and pretty much the same as you would see for even people just, who weren't exposed to Agent Orange. So the big takeaway is the importance of the VA's prevention tools as well as treatment options to help veterans stay informed and educated about their options for preventing as well as treating cancer. So I hope that this video helped y'all out a little bit, and I wish you all the best in the rest of your studies. What an awesome opportunity to be able to interview these Vietnam veterans. Take advantage of that because that's a great opportunity. And War Eagle.